The Affordable Care Act provides federal health insurance subsidies for eligible people that will reduce the monthly premium that they pay for their health insurance, thus making health insurance more affordable. Now, who's eligible for a subsidy? Roughly speaking, individuals earning between $15,000 and $46,000 a year, couples earning between $20,000 and $62,000 a year, and families of 4 earning roughly $31,000 to $94,000 a year could be eligible for a subsidy. Now, the amount of the subsidy is on a sliding scale, so the subsidy gets smaller as your household income increases. Subsidies are not available to people eligible for Medicaid, who typically are going to get basically free health insurance, or people on Medicare, or those who have affordable coverage through an employer. Now, in order to be eligible for a federal subsidy, you have to live in the U.S., be a legal resident of the U.S., can't currently be incarcerated, and you have to have an income level between 100 and 400% of the federal poverty level. The federal subsidy eligibility is determined by a modified adjusted gross income. What's that? Well, in order to calculate the modified adjusted gross income, you have to do a little math. Generally speaking, adding in all the typical income for things like wages, interest, dividends, rental income, etc. Then adding in any foreign income, employer-paid adoption expenses, interest from employee savings bonds, and then finally you would subtract things like moving expenses, alimony paid, self-employment and taxes in order to determine the modified gross income, or simply ask your accountant. Now, we're not giving any tax advice here, so please do seek the guidance of a tax professional. Subsidies are relative to the income and how many people are in your household. If you look at this chart on the left, you'll see the number of the people and the household size. Then on the right, you'll see the different amounts of income that people could earn to earn between 100 and 400% of the federal poverty guidelines. How do subsidies work? Well, first off, the federal subsidies are only available through the health insurance exchange websites. Customers who come to the exchange websites will provide their income estimates for the prior year, and then they'll learn how much financial assistance they might be eligible for. When choosing a health plan, they can use the tax credit up front to reduce the plan's monthly premium. They can also elect to take none of the tax credit and deduct it from their taxes later. The amount of the tax credit is the same regardless of what plan they choose, and people who are age 55 to 64 receive larger tax credits to help offset their higher premiums.